You know, I've been hearing this from my parents and to those who have their families already, that raising a child or bringing a child here in this world is very expensive. This is Nurse Raymond and welcome back to my channel. So in this video guys, we are going to talk about maternity care and benefit. So this video is particularly intended for those who has family here in Ireland, or for those who are processing their family reunification and excited to have an addition to their family, or if you are newly married and you're planning to start your own family, this video will be very relevant to you guys. And of course, if you are a single lady or a bachelor and looking for someone, well, this video will be relevant to you in the near future. But anyway, if you are interested about this content, please keep on watching. This video is very relevant to my family because, as you know, we are expecting another addition to our family and my wife will be due to deliver next month. So please pray for her safe delivery, and we are just very excited. Bear in mind guys that every woman who are here in Ireland is entitled for maternity care services, even if you're not a resident or if you're not a citizen of this country. So first things first guys, if you think that you're pregnant, please do pregnancy tests as soon as possible. And if that turned out positive, go directly to your GP to notify them, and your GP will give you a confirmation letter of the pregnancy and of course the estimated date of delivery. And that is very important guys, because your GP or your general practitioner or your doctor here in Ireland will be the one who will notify your chosen maternity hospital. Now in your first GP checkup, of course they're gonna do again a urine test just to confirm your pregnancy, and then afterwards, you know, a history taking, your blood pressure, your vital signs will be checked, and then afterwards a confirmation letter with the date of estimated delivery will be there. You will be referred to a maternity hospital of your choice, and depending on your GP, you might be charged for your GP visit or not. So in our case guys, we were charged for that visit. My other colleagues guys did not receive any charge for their first GP visit, so it really depends. Okay, now I mentioned earlier guys that you will be referred to a maternity hospital of your choice. So here in Ireland, across Ireland, there are a number of maternity hospitals which provides private or public maternity care or services. Here in Dublin, there are 3 known maternity hospitals, namely Rotunda Hospital, Coombs Maternity Hospital, and National Maternity Hospital. So in our case guys, we opted to go to Rotunda Hospital, which is nearer to our place. Now let me just reiterate guys that you need to report the pregnancy as soon as possible so that you will be referred to your chosen maternity hospitals, because there are some instances that the maternity hospitals are fully booked. So you need to, you know, go to another. So you have to bear that in mind, okay? In all maternity hospitals here, the front lines are midwives. So they are your point of contact in the maternity hospital. And of course, they will be with you across or throughout your pregnancy. As I mentioned earlier guys, there are private or public maternity services that are being offered in every maternity hospitals across Ireland. You may want to choose private maternity care or services if your pregnancy is at high risk or complicated, or it's just your preference. But please bear in mind guys that you need to pay a certain amount if you will choose to have a private maternity care, but the cost depends on every maternity hospitals. But to give you an idea, it should range between 2,500 euros to 6,500 euros. It really depends. And because this is a private maternity care, a consultant or an OBGYN will be the one who will check you all throughout your pregnancy. They will be the one who will assess you and of course deliver your baby if the time comes, okay? I know private maternity care is quite expensive, but please bear in mind that if you have a health insurance, some of the amount will be covered by your insurance company, and of course you can apply for tax refund or tax rebate at the end of the year if you take this private maternity care. Now, in our case guys, we took the public maternity care, which is as best as the private maternity care. Okay, let me explain. So if we are talking about the public maternity care, so this is a combined care, or what we call a shared care between a GP and of course the maternity hospital midwives. So once you have chosen your maternity hospital, your GP will send a referral to that hospital, and then afterwards, in a week or two, you will be receiving a letter from that maternity hospital congratulating you, and your first antenatal checkup will be in that letter as well. Now I'm gonna share with you guys the experience that we had on our first maternity hospital visit. So of course, initially we went to the reception. In the reception, my wife was given her medical record number, and then afterwards an appointment card. So in the appointment card, it is very important that you have it all the time, because all the appointments will be written there, but actually they're also posting the appointments. So after the reception, guys, we went to the waiting area wherein all the other pregnant women are there, and we were given, of course, a number. So you just need to wait for your queue, and while waiting, we were given a specimen container wherein a urine sample has to be acquired. Now, once your number is called, you will go to the midwife, history taking will be done, and vital signs will be taken. Of course, they will extract blood for your laboratory, and they will do MRSA swabs as well, which is very important. And after that, you will be directed to go to the ultrasound room. So in the ultrasound room, the sonographer will confirm that there is an embryo in your uterus. And then in their report, they will also put the estimated date of delivery. So after all those things that took place in your first maternity hospital visit, you will be receiving a further appointments for the following test. So number one is your GTT, or the glucose tolerance test. Also, you will be receiving an appointment for your anatomy scan, or the fetal anomaly scan, wherein they will check about spina bifida, cleft lip or cleft palate. They will check all the organs, and most importantly, the heart. They will check the valves, if they're okay and all that, okay? And if the midwife or the sonographer is not satisfied about the ultrasound, they will ask you to come back just to confirm it. Now, it's not done yet, because you as a pregnant woman is precious. So you will also be given further appointments for antenatal classes. So I bet you guys this is very, very interesting and beneficial for all expectant parents, especially if this is your first child. Now, the antenatal classes will tackle different things, from the pregnancy exercises, perinatal mental health, signs of labor, pain relief options, infant feeding, admission and discharge policy, postnatal care, and a lot more classes. So these are all the classes, antenatal classes, that you were advised to attend, okay? As I've mentioned earlier, guys, this is a combined care or a shared care between the GP and your midwife, okay? So it is very important that you go to your GP in between your maternity hospital visit and the classes, okay? So your GP, guys, will check your vital signs, urine sample, and of course, they will do the ultrasound just to check the heartbeat of your baby inside, okay? And once you reach 30 weeks gestation, the GP visit has to be done every 2 weeks. Now, this is good news, guys, because you don't need to pay for your GP if you are doing the antenatal care or follow-up checkup. So you just need to inform the secretary that you are doing an antenatal checkup. So that's free of charge. By the way, guys, your maternity hospital and your GP will advise you to have the COVID vaccine if you still don't have it, and the booster and the whooping cough vaccine. Okay, so we talked about the combined care between the GP and the midwife in a maternity hospital, but of course, community-based midwife can also take part throughout your pregnancy. So they usually provide maternity care for a low-risk pregnancy who have no medical history or any previous surgical problems that may affect the pregnancy. What will happen is the midwife will continue care for you and the baby with visits at home up to a week after birth. With this, you have to communicate with the maternity hospital so they can liaise this with the local health center, okay? Now let's talk about delivery options. Of course, throughout your maternity checkup, your antenatal visits, there will be a check about the risk of your pregnancy, if there is, and of course, the best suitable delivery options for you. So it could be normal delivery, cesarean section, water bath delivery if you choose to have that, and even home delivery. But this has to be discussed clearly and has to be agreed between you and the maternity hospital midwives. Is that okay? You know, I've been hearing this from my parents and to those who have their families already, that raising a child or bringing a child here in this world is very expensive. Now, the $1,000,000 question is, how much is to have a baby here in Ireland? How much is the maternity care services? The answer is, if you will have your public maternity care services here in Ireland, you will have to pay nothing, okay? You don't need to pay anything because, as I mentioned, every woman, pregnant woman here in Ireland is entitled for maternity care free of charge. Except, of course, if you opt to have the private maternity care, okay? Just to be clear. Now, another question, will your newborn baby be an Irish citizen automatically? Now, just to be clear, if you or your partner has been here in Ireland for 3 years out of the 4 years required of residency, your child will be automatically an Irish citizen. Okay, so that's about it, guys. I know that this video is quite long and jam-packed with information, but I know that this video will be very helpful to you. And mind you guys, I haven't discussed about maternity benefits, and that should be in the next video. So if you find this video helpful, guys, please give it a thumbs up, and please do subscribe to my channel and follow my Facebook page for all the latest updates, okay? And if you are someone who already experienced the maternity care services here in Ireland, please comment down below and please share your experience. So once again, guys, this is Nurse Raymond, and I'll see you in my next video. Bye!